So the first thing you're going to need to find is the Belmont tubing and then extension tubing, which are in the supply room. It's important that you get the extension tubing because the Belmont tubing is fairly short in the section that connects to the patient, and also because giving yourself a little space between the patient and the Belmont allows for a little more room to maneuver should there need to be multiple people at the bedside. One of the first things you'll need to do when you get it is plug it into the wall and then turn on the power, which the power switch is on the back here. You'll see it right here. So push it and hold it down, and then you're going to wait for the screen to kind of kick on. So machine's turned on, door is closed, and if you look on the screen here, it kind of gives you a brief 1, 2, 3, 4, 5, 6 step instructions for how to appropriately load the Belmont. So the first thing you're going to do is peel this open and take all of your tubing out of here. Okay, and I know that looks like a tangled mess, but if you look here, you can see that the tubing inside the Belmont is color-coded for where the various tubes need to run. So in my opinion, the best way to start is to go ahead and take this piece right here and clip it in to get it up out of the way. And it'll need to be low enough so that this clip right here can fit into this groove, okay? This clip here fits into this groove right above the pump. It has an arrow on the top that shows you the direction it needs to be pointed, a little blue arrow on the top. So that goes in here, okay? And then if you look, red goes to red. So I'm going to put my heating element right here in the middle, follow the red tubing all the way around until it gets to here. You have these two little pieces split here, okay? This piece goes on this side of the little safety clip because this is where it's actually going to go to the patient. This piece goes on the inside, and if you can see, skinny line, fat line, skinny line, fat line. You're going to follow this along. Your fat line goes right here, okay, and goes over your pump. This is what it should look like when it's loaded appropriately. It's important that the only fluid you prime your tubing with should be normal saline. So these two longer tubes are for your product. The shorter tube here is going to be for your saline. So I'm going to go ahead and pull my tab here and spike my bag of saline. So if you can see the screen here, now that we have our bag attached, there's a little button here that says prime. I'm going to hit the prime button and let it run. Okay, now if you look down at the screen here, it says it's primed, but that just means that the Belmont has primed to this little blue clip down here, okay? You're going to need to prime this piece here, which is the patient line. So I'm going to hold down prime patient line. All right, now here we go. The patient line is primed. The next step is you're going to hit this button that says infuse. This is the screen that's going to pop up. So if you look at the screen here, this is the rate that you've set, and it's very important to notice that on the Rapid Infuser, the rates are in mils a minute. This is the actual rate, meaning the rate that it's running, and it kind of has like it's like a smart device. If you set it super fast, it will work its way up to that rate as opposed to just going super fast right away. These two buttons over here adjust your infusion rate. You can go up and down as you see fit. So you and your partner are going to take your first unit of product out of the bag. You're going to look at this blood card and you're going to go through and check off all of these patient identifiers. You will both sign this card, one under transfusionist and one under witness. You'll put the date and time that you started it and then go ahead and get your blood going. When this unit of blood is empty, I'm going to take this blood card off of the blood and I'm going to put the date and time that blood ended, and I'm going to save this card. Another important thing to remember is that there are only two types of blood products that can go through this machine. You can give packed red blood cells and you can give plasma. Anything like cryoprecipitate or platelets will need to be put in a separate set of infusion tubing and run in slowly. You need to watch your clamps here. Obviously, you can have 2 bags of blood or blood products spiked at the same time, but you only want to be running one at a time. All right, so that's the basics of running the Belmont. If you have any other questions about it, feel free to reach out to any of the supervisors. You can also reach out to Amy and Elena, and they can get your hands on some of the educational tubing so that you can practice. But again, basics of the Belmont. It's one of my favorite pieces of equipment, and I hope you learn to like it as much as I do.